I started.
All right. Okay, good afternoon, everyone. Welcome back. We're sorry we were out for a couple of weeks. We were both sick, and we're back now. We have with us today Melanie Grant from Patience with Patience.
Hi, everybody.
Everyone say hello.
Hi.
We also have with her husband and her aunt, who's a nurse as well.
Okay.
Okay, everybody say hello.
Hello.
And this is Corlez, and I'm Naomi, and we're from
Fighting Through Our Pain
TV. All right. So,
Okay.
okay, we got some people already tuning in. Hi, Delma. How you doing? Thank you for tuning in. Go ahead.
Okay, Melanie, tell us a little bit about yourself.
So, my name is Melanie Grant. I am founder and CEO of Patience with Patience of America. I also was born with sickle cell disease, SS. I run and organize a patient advocacy program, an organization that assists patients who need better coping skills with the disease, understanding the disease, understanding how to push through that disease, as well as liaisoning between the healthcare provider and the hospital. What we do is we actually come in to the hospital and we assist the healthcare providers understand the patients better during acute phase of their crisis.
Okay.
Okay. All right. Tell us, about your childhood when you were younger with sickle cell anemia.
Yes, tell us your story.
Well, both of my parents have the trait. So I came out with it fully. As we know, it's 1 in 4. So there's a 50-50 chance every time you have a child that it will come out. And I just was the lucky one. So I had a hard time because I lived in New York. And of course, as we know, it's frigid cold in New York around the winter time, and winters last very long. So my childhood living with the disease was very difficult in the beginning because almost every Christmas, I was in the hospital. I haven't had too many complications other than having my appendix out as a child. I've also developed osteomyelitis in my right elbow. When I was a child, I had to actually, at the age of 7, give myself injections, which is penicillin injections. At that time, that was the only thing to really treat an infection like that. So between makeshift with my father and him and my mom's a nurse. So with both of them actually going through the process of taking care of me every 3 o'clock, every 7 o'clock, giving myself injections, I was able to overcome the disease during that time. And it was harder, I believe, as a child. Now as an adult, it's definitely easier to manage. But as a child, I had a lot of difficulty.
That's interesting. You said, so I never heard that. I always thought you had to have surgery for it because I had the same thing you had the same thing.
No, I had it with my hip.
Oh, okay. I had it in my knee and they gutted everything out. So that's why I've never heard they could do that with the injection.
So yes, at the time, I had it in my elbow. They didn't have to do surgery. They just treated it at the time and see if it would eventually go away. And it was about at least 3 to 4 months, I think, of treatment, at-home treatment, because I was in the hospital for at least, I think, maybe 6 weeks. And then after that, we turned over to hospital inpatient home care, where I still had the IV pole and things like that. So, the type of osteomyelitis that I had, it wasn't as aggressive where they had to do surgery and gut anything out. Luckily, it was something that they could have treated, but it had to definitely be treated with round-the-clock care.
Okay.
Okay. I see you have your spouse here. I just want to ask you a question. When it comes to your spouse being sick, what is the coping mechanisms to help her feel better, to make sure she's doing okay, that whatever she needs, you're there for her?
Just understanding that she's in pain. It took a little bit to try and get used to the routine. And once you get the routine down, when she's saying she having this is hurting. I asked her if she take her medication. If she haven't taken her medication, take a half a tablet now. Wait for a little bit and see how you do that. Heating pads and water and lots of fluids. So just learn how to take care of her. But I mean, it's tough, but mostly on her, you know.
Yeah. I want to ask the aunt. I know you are a nurse, and how often are you dealing with a patient with sickle cell?
Believe it or not really. It's
Okay.
most of my family members.
Okay.
I have a niece that's 7 months, and she's currently having a crisis now.
Oh wow.
So we're dealing with new parents that are not familiar with it, other than having their family members go through crisis and not really understanding. So now that they're doing it themselves, it's what do I do? You know, her hands are swelling. Is she crying because she's in a crisis? Is she crying because her tummy hurts, or is it because she's wet? You know, so I think that is probably the most challenging part as an aunt, because as a nurse, I can treat it differently. I'll be able to treat any disease differently.
Yeah.
When it's a family member, it's a little bit different. You know, I'm Melanie's phoned a friend, you know, when it happens. With my niece, I play the aunt role. The nurse mode kicks into gear, but again, the family part it's more difficult.
That's true. Okay, so I want to go to Melanie. I know you have your advocacy program, Patients for Patients. Patients with Patients. I'm sorry. Can you explain what made you start your program?
Well, I was, when I was younger, I had a mother, of course, like I said, that was a nurse. And having a healthcare professional in the family definitely changes how you're able to interact into the hospital, how you're able to speak with the healthcare providers, also the knowledge that you gain. I was able to gain a lot of knowledge and hospital jargon that I wouldn't have known if I didn't have someone who dealt directly with those type of patients, also have a child that has the disease. So that really was something that I've always prided myself in having, because it changes when you are in a situation where maybe you're in an economic, sociological, different background where you don't have the knowledge, you don't have the know-how, and it's harder to get your point across or talk to a physician. Even dealing with the crisis at home, it becomes a little hard because you're not able to really and truly say to yourself, okay, what do I do next? You're more quick if you don't have the knowledge to just run to the hospital. And instead of going ahead and fighting that disease at home and then saying, let's see, is this a crisis that needs medical attention, or is this a crisis that I can handle on my own? And so a lot of that in my teenage years, even in my 20s, I was able to come in contact with some providers who knew how to treat sickle cell, and then some providers who had no clue. And that really was something that sometimes my mother actually, Barbara is her name, she is also the president of our organization, and she is someone who came to Florida in the 80s and had to teach the doctor that I had at the time how to treat me and how to treat sickle cell patients on a whole, because even though he had the knowledge, it was harder for him to implement how to effectively treat each patient differently. So with her help, that was something that she was able to do. And I think in turn with me, I said, you know what, why wouldn't we be able, if I have so much knowledge and so much expertise on how to handle the disease, I think that having the access through advocacy is something that was really important. In addition to deciding to start this organization, I really had to focus on what was the purpose. And I went to Jamaica, where the treatment and modalities are a lot different. They don't have access to medication like we do. They don't have access to the treatment like we do. So I went to a physician who came from England and dedicated his life, Dr. Graham Sargent, and he created a whole network of hospital patients that were testing the patients in Jamaica. And he basically, now the modalities that we use here in America, he is the one that we go to kind of reference in teaching. And he's the professor for all of the sickle cell advocacy and sickle cell disease treatment and management in the United States and across the world. So I went to him. I was able through Dr. Harrington to get in contact with him. And I said, what did you think was lacking? What do you think? Why do you think these patients are getting so sick? What's happening? And he kept saying to us, education, education, education. And he drilled that into my head. Mm-hmm. And so when I asked him, if I started this thing, do you think, what do you think I should find? And he said, anything you do, make it based on education first and then advocacy second. And I felt like if we were able to do that, and through a lot of come to Jesus moments with me and God, and also having my own experience at the age of 30, I developed pulmonary hypertension. Wow. And so I had to have a moment with God to figure out, what was I supposed to do next? And, he said, listen, if you dedicate your life to something that's so far above you, then, there's unlimited possibilities of what you can and can't do. And I'll make sure that you do everything that you need to. And so that was the reason why I started it.
Okay.
Mm-hmm.
Okay.
Yeah. Okay. That's awesome. The question I was saying, explain more, how do people be able to, join your program and, tell us more. Yeah, exactly.
So in order for you to become an advocate, in order to join, now anybody can, what we do is there's two facets. So you have patients who have the disease and need an advocate. Mm-hmm. And then you also have people who are already caretakers in their own life and they want to become an advocate. So we have patients that we take on that, say, I need some help. I want to reach some goals. I want to attain certain things. I maybe don't have the right physician. My treatment and management skills aren't where I need them to be. Mm-hmm. I also maybe have a dependency because I'm taking so much medication. I need to figure out, how do I stop taking this medication, or how can I manage it better? Those are the things that we work through with patients on the patient side, where they actually speak with not only an advocate, but they also speak with a nurse. They also talk to their own physician, and we both kind of figure out a happy medium for the patient. So anybody can become a patient that is overseen with an advocate, that's appointed an advocate with patients. So that's that part. Then you have the advocacy part, where people say, what, I'd like to also be an advocate. Mm-hmm. I want to, help out other patients like me. So once they've reached a certain point in their care, what we do is we do an evaluation of the people who want to be advocates. Mm-hmm. Either they're nurses, healthcare providers, or themselves are a mom or dad or someone who has the disease, has a daughter or a son that has the disease. Mm-hmm. And they're already caretakers in their own life. Yeah. Mm-hmm. Or you have patients who say, I manage my disease so well, I'd love to kind of pay it forward, like a each one teach one thing. Mm-hmm. So I feel like our headliner is that these advocates that come on, first they have to go through a certification course. They have to be certified so they understand how to relate to a patient. Some people's personalities don't gel with others. So we have to really know if we can point you with this person and you guys will get along well. Mm-hmm. The certification course is a 4-hour class that we give. We're doing actually our first session coming up, a live session in Coral Springs, Florida at the Northwest Regional Library, where it's 12 to 4. You actually get a one-on-one, not only with a senior advocate, mm-hmm. But you also get a one-on-one with a nurse. There's some role playing going on. You can really get a better handle on how to treat those patients. And then we give you a 90-day period where you're with a senior advocate, you're going into hospitals, you're meeting with your patients, you're talking to them, you're having phone conferences and things like that. So those are the two ways. You sign up online with patientswithpatients.org/donate, and you can register for the class. And that's basically, we have a webinar, which is a 2-hour session, and we have a 4-hour in-session class. So those are the two ways that you would basically say, hey, I'd like to, be a part of the organization. If you're a healthcare provider or a case manager, you also can just go on our website, and we have a career page where you can see what we're hiring for at the time.
Okay.
Mm-hmm.
Okay.
So let me ask you, because I know it's hard for me. Saturdays are like
I know.
work days. It's hard to get off.
Yes.
If so you said the webinar is that part of it, or you have to do the live class as well?
So when you do the webinar, you'll still be able to get a full chunk of the class content, but it is only 2 hours, and it limits you to just a phone conference.
Oh, okay.
So you're a compassionate, what we call compassionate conference advocate, meaning you're able to provide that phone support. If my patient calls you and says, hey, I need help, I'm having trouble, you can guide them with the proper steps that you've learned in the class. And I think that the in-session class that you get is more compiled with you actually doing the role play, with you actually, learning the chain of command, the hospital protocol. We kind of shorten the class on the webinar just because you only have 2 hours, and it's really and truly just getting you to understand how to relate to that patient.
Okay.
Mm-hmm.
I want to hear one of your stories. We always ask one of our interviewees, give me a story, an in-depth story of with sickle cell, that it had an impact on you that really changed your perspective of thinking about sickle cell and being helpful to the cause.
So, a story that I can remember that impacted my life. Okay, is it about me or is it about somebody else?
Your
Me?
story.
Okay.
Yeah.
So I just want to make sure.
Yeah.
Well, with me, I think that I had a life-changing experience. I've had many. With sickle cell, you have many experiences that,
True.
are... So I have two main experiences, but one that I can say that drove me to advocacy was when I developed pulmonary hypertension and not finding a physician to be able to treat a sickle cell patient that had pulmonary hypertension. So that was my problem. And I was prepared at the time. I'm 36 now. So 6 years ago, I was prepared to go to Pennsylvania and get on a flight, meet this lady that I Googled. I was so frustrated. I would sleep literally a week straight because when you have a crisis, even if you're not in crisis and your oxygenation level is already depleted, but imagine if you now have something that automatically hinders your oxygen on top of having the disease, that makes your brain not able to function, so you get tired.
Yeah.
So I didn't realize one week straight I slept. I got up to only eat and drink, and that was it.
Wow.
And I knew at that point something was wrong, and I went to my primary physician. I said, hey, I got to figure out something. He sent me to one physician. He had great intentions. He put me on some medication for the pulmonary hypertension, but you also have to be careful with pulmonary hypertension medication in sickle cell patients because it could have an adverse effect and even cause a crisis. So that was something where he put me on medication, but he realized that it was above his head. And I commend physicians out there that say, hey, this is something that maybe I need, a second opinion because I don't know. And a lot of physicians, I know that they're so caught up in knowing that some of them are not in the position to say, hey, you know what? I don't know. Right. Yeah. This is above me. So, that was Dr. Foster. He's amazing. He said, you need to go to this physician, and he pointed me to somebody in Miami. And then that was when the physician he gave me turned me and said, "Who's your hematologist?" And that's how I met Dr. Harrington.
Oh, okay.
And Dr. Harrington was able to say, okay, this is what we need to do. This is who I'm going to give you. And because he knew how to treat sickle cell disease and pulmonary hypertension and sickle cell disease, it was a great relationship and friendship that we were able to develop with the team, that we can overcome this disease. And so that was my turning point of, asking God, listen, you already gave me one thing. Like, you really are going to give me something else? And it really made me feel like, come on, right? And so that was my turning point. If I had to say, I've had multiple experiences with DVT and things like that. And I actually had one traumatic experience in New York where I was in a severe crisis. There was no medication. They didn't want to give me medication, and all kind of stuff, that I ended up staying and spending Christmas a month in the hospital in New York. So and I was wheelchair bound for like at least 2 months after that.
Wow.
So I've had multiple experiences. That was just a quick synopsis. Even coming on the plane, my mom as a nurse having to get into the cockpit and talk to the medical department that I can even fly on JetBlue. There are so many things that we can get into. But as far as a life-changing experience, that was definitely something where I said, you know what, imagine how many people who don't have this. Imagine who people don't have the access. And there's so many of us, especially the African American community. We do not have sometimes the access, and even the physicians who have enough knowledge to say, hey, you know what, we should, do this, or I should turn this over to someone else.
Exactly.
And even the knowledge to go seek that. Seek that access. A lot of people just don't know. They have no clue of what's out there.
True.
I'm working on something. I'm not going to speak on it just yet. But I'm trying to make it accessible. To everyone. That they have people to go to. Doctors to know nurses.
That's perfect.
Healthcare providers and administrators. I'm working on something.
It's so funny because you say that, because I just today, as I was getting dressed this morning, I heard something or last night I was doing my hair, and I heard for assisted live, for people who are looking for somewhere to put their mom or dad, right? And they want like an old folks home or something, somewhere that their parent will be catered to. They had an infomercial about how we can find the right person based on your mother's personality or your father's personality, based on what agency that treats, that will be able to cater to their ailment or disease. I was like, they have that. Imagine if we had that, where they could just point you directly. You just call, they point you directly. Get on it.
I'm working in silence on this one. This one is kind of dope. So I'm working on it.
It's going to be amazing.
I really do believe a lot of the problem is that they're not aware that there information out there. We're now just getting into the Googling and the Instagramming and the Facebooking, and they don't know, especially these younger parents that have a child that has SS or C. They have no idea.
They have to learn how
they're learning.
Yeah, those younger parents have to learn, first of all, how to settle down.
Right.
Because when you have a child with sickle cell anemia, you're going to have to learn how to settle down and stop and pause your life for a second. Because let me tell you something. That child with sickle cell anemia is going to put your life on a total different platform, because you're not going to know what hit you. You're not going to be able to want to go party like you wanted to do. And hang out with your friends, because guess what? Your child comes first.
And it's on pause. And I think, the first thing they want to do is to call the doctor every 5 minutes, because you're not sure. They're not sure what it is.
Exactly.
What is it? Is it this? Is it that? And again, a lot of times the doctors may seem nonchalant. And as a parent, you're like, I want something done now. Yesterday. Okay, my baby's crying now. And the doctor's like, okay, yes, and it doesn't seem quick enough for us. So if they had the right avenues to go to or pointed to, and not just, okay, well, what did this parent do? And this one, if they had the right avenues, I believe that would be
I thank God for Dr. Harrington, because let me tell you something. Even if you don't, like Melanie was saying, she didn't know, nobody knew. But as soon as she got pointed to in the direction of Dr. Harrington, he knew. Dr. Harrington knows a good OGBYN.
Yes.
He knows a good
You name it, he knows
any
it.
type of doctor that you think you may need,
Yes.
from eye doctor to everything, he knows.
I call him, you know, and this is so crazy because, you know, I don't know about other diseases, but I can only speak from what I know. And I know that for sickle cell disease, okay, a minority-based disease, even though we know that there's a bunch of Caucasian people that have it, there are Spanish people who have it, there are Mediterranean people who have it.
But we're the majority.
But as the majority, there is a relationship that needs to happen if you have sickle cell disease with your physician. Your physician must be like your next of kin.
Yes.
That's how close your physician, because if you're not in that position where you have that and you have someone who really understands you as an individual and knows that this person is not somebody who gets sick all the time. This is not somebody who, you know, cries wolf all the time, especially with all the stereotypes that comes with sickle cell disease. If you don't have a relationship that you can connect, I call physicians, especially when they're physicians that you can connect with.
Yes.
I call them like Dr. Dad. Like literally that's your Dr. Dad, because that person is saving your life. And they're also, not only are they saving your life, but they're doing everything necessary to make sure you're okay.
Yeah.
Just as a parent would.
They become connected to
They
you.
become connected.
Yeah.
And this is why it is important, even through advocacy, because there's so many people that have physicians that they only see every 3 months and that's it. They only go for the blood test and that's it. And then there's other physicians like that straight up just, they're waiting for you to come in for your checkup so they can get their check and that's it.
Yep.
So we have to be, you know, as steadfast, especially through advocacy, to understand that if you're not in a relationship with your physician, if you do not know that person in and out, and I know that there's some physicians that may not work as quick as Dr. Harrington does for us, because you know, you email him and he's right there.
Yeah, he's
In 2 seconds. And you're like,
Yeah.
well, what does he do? He has so many patients. How does he get back to me? But if you don't know, especially even us with family planning, you know, understanding that, you know, there's some patients who are interested in family planning and understanding the severities of what will happen through family planning or what could happen just because you have sickle cell.
Yes.
You know, I've had a lot of friends who, if they have the disease, it's they're scared. They don't know what to do. They're, you know, even me, I'm always in my own head like, something's wrong. Something's wrong. Something's wrong. When it could be just nothing. It's just me just being in my head, you know?
Yeah.
And so it's very important. And I think that that's the first point of business when you're choosing a physician.
I could tell you had something to say.
Yeah, I was saying the advocacy program, especially what we do, providing the education. Even the doctors or the physicians get a certain amount of education about their specific patient that they're taking care of.
Yes.
That way it avoids the mass treatment. Because a lot of times with those patients who are going in 3 months, and they never see their doctor again until the next time they're in crisis. And they're being mass treated. So
and that's the thing. I think that's such a great point. With sickle cell, if you treat it like a textbook, what happens is the patient doesn't get the care that they really need. So they're just getting the basics. They're getting the hydrea, they're getting the folic acid, they're getting the textbook, right? But when you're talking about a physician that is open to allowing you to have the advocacy and allowing you to have an advocate that they also can communicate with, to know, because remember, as an advocate now, right? You also, if you're directly connected to disease, if you have the disease or you're a family member that has the disease or something like that, and you are an advocate, you know when that patient is telling you the truth or not. You know when that patient is really in crisis or not. You know what's going on. So that gives the physician the inside to understand that patient a lot better. And I remember I had a physician. He was amazing. He passed away. But Dr. Alif was my physician, and he was so upset. I went to New York and they were like, is she really in crisis? And he's like, do you realize that this person does not go to the hospital unless something is really wrong?
Yeah.
He was like, get out of the hospital now. Come back home.
Yeah.
Because
right there.
it is true. And as a mother, having a new baby, thinking about how are you going to help my child understand why they're in pain, and then you also understanding why baby's in pain, why baby's legs are swollen, why baby's going through. Having someone or even a parent who went through it as your advocate, right? It's like that each one teach one thing is so powerful, because you have a mother who will say, okay, listen, this is what happened to my baby. Now, maybe it may be different for yours, but let's see how we can handle it together.
Exactly.
Yeah.
There's a camaraderie that you build with moms that have, like I know my mother was going to the hospital every so often, all the time. And her best friend at work would say, how do you bounce from going into the hospital and you have to go back to the hospital to see your daughter? And eventually she had her children. Her children did not have the disease, and at the age of, I believe, 40, she had her last child.
Oh, wow.
And her last child ended up coming out with
Sickle cell?
SCD.
Wow.
And it was like, she was like, wait, no. Like, literally, how is this possible? Nobody in my family has it. How? And she ended up finding out that the dad had, even though all her other children don't have it, the dad had a gene in his family that it came back up. And therefore, she was able to use my mom as her guide to now her daughter's 12 and 13 going through crisis. She's doing the same thing. They're running back and forth where she said she could never. But that advocate part about it, that has that someone to call, is definitely important.
I think before, with having the doctors and the nurses being compassionate.
Yes.
Because again, there is a stereotype, and you will have a lot of nurses and a lot of doctors that will say, are they really in a crisis?
Or do
Are
they
they
want
really
the
in
drugs?
pain?
They
They
just
just
want
want the drugs. So then, you're stuck between a nurse who's supposed to be taking care of you, that is your go-between, is even your doctor at the hospital, and she doesn't even believe you're going through a crisis. So, the advocacy program in that perspective, to me, is very, very helpful. Because they can call and they can say, I'm going through this and nothing is happening. And that way they can go through the proper channels, knowing that their advocate can actually be of some use and be of some cause and help them through.
Most definitely.
Being addicted to the medication or what have you is a whole nother problem again, because I'm pretty sure you have inmates who probably have the disease all their life, and now they're addicted to the drugs. They're not getting the type of help that they really need. They think they're just drug addicts, and being black
That's true.
and being addicted to is like
That happened to,
lose.
believe it or not, I know, I don't know if everybody knows, but Mobb Deep. Do you guys remember Prodigy from Mobb Deep?
Yeah.
That passed away. So he was in prison, and he spoke about this before, that he was in prison and he said he was having a sickle cell crisis. And he was in confinement at the time, and they did not believe him. And he literally went hours and hours and hours in agony and pain, and they thought it was a stunt that he was pulling, and just to get out or something. And truly, even the prison system, not having the proper intelligence and protocol in place for someone who has a disease that's all pain-based. So imagine a pain-based disease. It's just pain-based, and you can't tell if the person's telling the truth. Because what? It's their own body. You can't feel it. You can't see it. It's not like warts are going to come up on his skin. So that Prodigy ended up having such a hard time while he was in prison. And there's so many people in prison right now that deal with that and don't have the proper treatment and don't have the proper management. And even a physician that even understands in the prison system to how to treat or manage the disease.
They're not there for that.
They're not there for that.
They're there to have you as a slave.
There you go.
Manual
There you go.
labor.
There you go.
For $1.10 per day.
Yeah.
And
That's
they're
what
not
they're
going to
there
get
for.
the medications
Exactly.
that they need anyhow.
Exactly.
Because they're only going to give them the Tylenol, and that's it.
Yeah.
They have their protocols as well.
Yeah.
Lack
And
of
I-
education.
Yeah, the education, the protocols, everything, all that is needed to be done for sickle cell. And I commend you on your work. Oh, well, that's finishing. Do you want to continue? Yes. What
All
happened?
right. So I just want Melanie. I just want you to give one last word. This is what I always ask. I say, what do you want the world to know about sickle cell patients?
Wow. It's a lot. One question. What do I want the world to know?
Within a little bit of time because it's going to
Right.
close.
I
Yeah,
only got 2
because we had to
seconds.
say something too. Go ahead.
Okay, so if I had to say I wanted the world to know something, I would like the world to know that if it's without proper treatment, guidance, and management, sickle cell disease as a whole, and all patients with sickle cell disease, will not be able to effectively live the life that they need to live and want to live if they don't have the proper management, the proper education, and the proper guidance. Also, it's really important to listen to the patient more than anything else. When that person says, something's not right, I do not feel good, listen to the patient. And a lot of the population, they don't understand, so they're listening, but are they really listening? And so that is truly listening and then taking action to do what's necessary to help that patient, or maybe family member, whatever it may be. Just making sure that you're doing your research, you're doing enough research, you're making sure that wherever city you live in, wherever you live, you do what you need to do. So that's what I'd like to know.
Okay, perfect. I just want to take the time to thank Melanie,
Yes.
her husband, and her aunt for coming on our show today.
Thank you so
We
much,
appreciate
guys.
you. Naomi's here, and we're getting ready to
And
have
sign up for the class, guys.
Yes,
Sign
trust
up
me.
for the
I'm gonna
class.
send me the link
I
to
will
my
send
class.
the link. Yes.
We're getting ready to have our second.
And before, we just want to say thank you again. And thank you, Melanie, for telling your story. And those of you,
Thanks
we
for
see you
having
guys out watching. We see you, Mario, Tina. It's many of you that came in. Thank you so much for watching.
Thank you,
We do
guys.
have another show coming up, as she said. Stay tuned. Facebook, we'll have to turn it back on.
And Instagram.
And Instagram.
Yeah.
Yeah.
Yes,
So
guys.
listen for our next show. We have ASAP that will be